Namaskar. I am Dr. Aarti Chaudhary, Assistant Professor in the Department of Ancient Indian History, Culture and Archaeology at Vasant Kanya Mahavidyalaya, Banaras Hindu University. I welcome you once again in this module, and the title of this module is Healthcare and Surgery in Ancient India, and we are now in the lecture 3rd, and the title of lecture 3rd is Vagbhata, and the course name is History of Science and Technology in Ancient India from Harappan civilization to 7th century CE. In our last lecture, we have discussed about Charak and Charak Samhita, we have discussed about Susrut and Susrut Samhita, and now we are moving towards the literature of Vagbhata and the introduction of Vagbhata, basically related to the Indian medicine. So, at first the learning objectives of this particular lecture. The first learning objective is to understand the fundamental principles of Ayurveda as taught by Vagbhata. The second learning objective is to study the method of diagnosing disease and applying therapeutic measures described in Vagbhata text, and to explore the emphasis on preventive health and ethical conduct in medical practice described by Vagbhata. In this topic, we are going to discuss about the life and work of Vagbhata, date of Vagbhata, scholars' view, contribution of Vagbhata in medical sciences, commentaries, the 8 branches of Ayurveda according to Vagbhata, 6th Sthan, new insights in disease classification and prognosis by Vagbhata. Vagbhata was one of the most influential scholar of ancient Indian medicine and a key figure in the Ayurvedic tradition. He is traditionally regarded as the author of 2 foundational texts, Ashtanga Hridaya Samhita, heart of the 8 branches of medicine, and the Ashtanga Sangraha, compendium of the 8 branches. These works synthesized and systematized earlier knowledge from the Charak Samhita and Susrut Samhita, making Ayurveda more accessible and practically useful. The Ashtanga Hridaya, written in verse, gained wide popularity due to its clarity, brevity and emphasis on clinical practice. His writings had a lasting impact not just in India but also in Tibet, Sri Lanka and other regions influenced by Indian Ayurveda. Today, Vagbhata's Ashtanga Hridaya remains a core in Ayurvedic education and is still studied and applied in traditional medical practices. Now, the debate regarding the date of Vagbhata, chronological uncertainty and scholarly view. Varamihir 505 CE quotes formulations found in Vagbhata text indicating Vagbhata's earlier existence. The Chinese traveller Itsing, who visited India in the 7th century, mentioned the Ashtanga Sangraha. Madhav Nidana 7th-8th century CE contains many verses from Ashtanga Hridaya confirming its earlier composition. Other scholars like Gurupad Haldar place him in the 3rd century CE. Harnale and Winternis suggest 625 CE for Vagbhata first and the 8th and 9th century for Vagbhata second. Based on internal and external evidence, Vagbhata first likely lived between 400 to 475 CE and Vagbhata second in the 5th and 6th century CE. So, these all debates are basically related with the date of Vagbhata first and Vagbhata second. We have to rely on the different text or different sources produced by the different scholars on the basis of their study. We have to focus on that research to trace the date of Vagbhata. The life and work of Vagbhata. Vagbhata was the son of Sengupta. He was named after his grandfather, who was a great physician. He was born into a Brahmin family and received his education from his father and Buddhist preceptor Avalokit. Vagbhat's major contribution to Ayurveda include the authorship of Ashtanga Sangra, a comprehensive treatise that is part of the Brihatrayi great trilogy of Indian medicine alongside Charak Samhita and Sushrut Samhita. Ashtanga Hridaya is divided into 6 sections: Sthan, Sutrasthana, Nidana Sthana, Sharira Sthana, Chikitsasthana, Kalpa Sthana and Uttara Sthana. It contains 120 chapters and 7312 verses. The text is written in simple language with the use of various chand, making it easier to recite compared to other samhitas. Different type of commentaries also written on Vagbhat text on Ashtanga Hridaya and Ashtanga Sangra, and these commentaries are very useful to understand the proper textual description on the basis of the commentaries itself. And here is the few examples of commentary based on the Vagbhat text, which is Padartha Chandrika, a detailed commentary on Vagbhat Ayurvedic text providing explanation of complex term and principle for better understanding and practical application in medicine. It is the earliest available commentary on Ashtanga Hridaya. Sasi Lekha by Indu is a renowned commentary on Ashtanga Sangra offering clear and detailed interpretation of Vagbhat Ayurvedic principle. Ashtanga Nighantu, it provides a list of medical substances along with their synonyms and use, providing essential Ayurvedic knowledge including regional variations such as Telugu names. Sarvanga Sundar by Arun Dutt, 13th century CE, major commentary on Ashtanga Hridaya. Ayurveda Rasayan by Hemadri, 13th century CE, explain formulation and clinical use. Now the 8th branch of Ayurveda according to Vagbhat. Ayurveda, one of the world's oldest system of holistic medicine, was classically structured by Acharya Vagbhat into 8 specialized disciplines known as Ashtanga Ayurveda, the 8 limbs of Ayurveda. These branches reflect the profound depth and versatility of ancient Indian medical science, offering a comprehensive guide to health, well-being and longevity, reflecting a new dimension of thought. And what are they? They are Kaya Chikitsa, internal medicine; Bala Chikitsa, pediatrics and Kaumare Bhedya; Graha Chikitsa, demonology and Bhut Vidya; Udhavang Chikitsa, Salaka Tantra; ENT and ophthalmology. ENT means ear, nose and throat; Salya Chikitsa, surgery and Salya Tantra; Damastra Chikitsa, Vish Chikitsa, toxicology or Agada Tantra; Jara Chikitsa, Rasayan Chikitsa, geriatrics and rejuvenation therapy; Varsa Chikitsa, Vajikaran Chikitsa, virilization and aphrodisiac therapy. Now the explanation of Kaya Chikitsa, internal medicine. This is the foundational branch of Ayurveda that deals with the treatment of bodily ailments arising from imbalance in the 3 dosas Vata, Pitta and Kapha. It covers a vast range of conditions such as fever, digestive tissue, diabetes and general systemic disorder. This branch is comparable to today's general medicine. Now Bala Chikitsa, dedicated to the care of children. This branch outlines practices for parental or postnatal care, neonatal care, proper breastfeeding, immunization technique using herbs and the treatment of childhood disease. It highlights the Ayurvedic understanding of development, physiology and psychology. Grah Chikitsa. This intriguing branch deals with mental disorder and disease believed to be caused by unseen entities or spiritual affliction. While it includes mantra and rituals, it also reflects a deep awareness of a psychosomatic disorder, making it Ayurveda's counterpart to psychiatry. Urdhvanga Chikitsa, ENT and ophthalmology, focused on the head and sensory organ. This branch addresses disease of the eyes, ear, nose, throat and mouth. It includes sophisticated treatments for cataracts, dental care and nasal surgeries. Next is Salya Tantra, surgery. One of the Ayurveda most advanced branch, it details surgical instrument, yantra and shastra, techniques such as excision, incision, suturing, cauterization and more. This branch is testimony to the surgical genius of Indian sages, particularly relevant during time of war and injury. Even complex surgeries like rhinoplasty were performed successfully during this era. Damastra Chikitsa. This branch focuses on detoxification and the treatment of poison from various sources, snake bites, insect stings, plant toxins and even food poisoning. It also provides protective measures and antidotes, reflecting a highly developed understanding of natural toxins. Jara Chikitsa, rejuvenation therapy. A visionary branch Rasayan aimed at dealing aging, boosting immunity, improving memory and prolonging life. It includes a specialized herbal formulation and rejuvenation regime that promote longevity and youthfulness, making it in the ancient blueprint for anti-aging medicine. Varsh Chikitsa, aphrodisiac therapy, Vajikaran. This branch addresses fertility and sexual vitality. It includes therapies to enhance reproductive strength and quality of progeny, along with psychological well-being related to intimacy. So, after the explanation of the basic text structure, the second information which is very prominent in Vagbhata text, that is Chikitsasthana, and first one is Sutrasthana, 30 chapter or adhyay and 1603 verses is present in Sutrasthana. In Sharira Sthana, 6 adhyay is there, 457 sutra present. Nidana Sthana, 16 chapter, 785 verses. Chikitsasthana, 22 adhyay and 1975 verses. Kalpa Sthana, 6 adhyay and 258 verses. Uttara Tantra, 40 adhyay and 2234 verses. Incomplete, this is 6 Sthana, 120 adhyay and 7312 sutra. Now, what is Sutrasthana according to Vagbhata? So, the foundation of Ashtanga Hridaya and core principle. Sutrasthana is the opening section of Ashtanga Hridaya and is considered the best summary of all Ayurvedic classics. It serves as the foundation for understanding the entire Ayurvedic principles such as Tridosh, Agni, digestive fire, Kostha, digestive tract and Dhatu, body tissues. The treatment method is Shodhan and Samana. Sutrasthana introduced two main therapeutic categories, Shodhan, purificatory therapies and Samana, palliative therapies. Shodhan therapies, Panchakarma, are elaborated in chapters such as Sneha Vidhi, Sweda Vidhi, Vaman Virechan Vidhi, Basti Vidhi, Nasya Vidhi and Sirvedha Vidhi. Saman palliative treatment are also discussed, including methods like Pachan, digestion, Deepan, appetizer therapy, Vyayam, exercise, Tap Sevan, sun exposure, Marut Sevan, exposure to wind. So, in the Sutrasthana, the connection of the human body and nature is also described beautifully with the words of Tap Sevan, Wind Sevan. It is very important to just make the balance, make the relationship properly with the nature to smooth survival in this earth. The concept of Chatushpad, 4 limbs of treatment is also explained, offering a structured approach to Ayurvedic therapy, Sodhan, Saman, Brahman, nourishing therapies and Rakshak, Rakshas, demon related treatments. Next is therapeutic procedure and eye care. Tarpan, Putpaka, Ashchotan, Anjan are detailed as therapeutic method specifically for the improving eye health. The text also explain Yantra Vidhi, use of instrument, Shastra Vidhi, surgical procedures and other techniques like Agni Karma, cauterization and Char Karma, alkaline therapy, important for treating various conditions including wounds and abscesses. Surgical principle and drug evaluation. Introduce basic surgical procedures such as Salya Haran Vidhi, removal of external objects and Shastra Karma Vidhi, use of surgical instrument. Drug and diet evaluation is guided by principle like Ras taste, Gun properties, Virya potency, Vipak post digestive effect and Prabhav specific effect which determine their effectiveness and suitability in treatment. Fundamental theories are also here. The text discussed Samanya Vishesh Siddhant, theory of similarity and dissimilarity, and the Pancha Mahabhut 5 elements theory which explain the relationship between the physical and spiritual aspect of feeling. The physical and spiritual aspect of healing is also mentioned by Charak Samhita and Sushruta Samhita, and it is also mentioned in Ashtanga Hridaya and Ashtanga Sangraha by Vagbhata. Pancha Mahabhut, this whole structure of the body is made by the Pancha Mahabhut, Agni, Jal, Vayu, Akash and Prithvi, and these Panch Mahabhut is necessary to balance in human body and in nature as well. So, sake of the good health, Vagbhat also mentioned the balanced way of lifestyle regarding the good relationship between the nature and the balance of Panch Mahabhut inside the body and in the mindset as well for the healthy life. Now, Sharira Sthana. Definition of Sharir. Sharir is described as the union of the Atma, soul and Panch Mahabhut elements. It is the physical body that houses the soul and undergoes birth and death. Importance for Vaidya. A Vaidya must have fundamental knowledge of the Sharir for successful treatment and health maintenance. Understanding the body's structure and function is essential for diagnosis and treatment. Ayurvedic embryology is also mentioned in Sharira Sthana. The section covers the development of the body, focusing on the stage of embryonic growth and how the body forms from connection to birth and death. Next point is anatomy and physiology. Detailed explanation are given about the anatomy and physiology of the body, including the structure of organs and tissue, their function and their relationship to health. Next is Nidana Sthana. Nidan Panchaka. Vagbhata is the first to describe the Nidan Panchaka, which outline the 5 main aspects of understanding disease: etiology, cause, pathology, change in the body, sign and symptom, prognosis and treatment. Disease category. This section describes various diseases such as jwar, fever, raktapit, hemorrhagic disorder, swas, bronchitis, hiccups and other, with a focus on their cause, symptom and outcomes. Pathological understanding. It presents an understanding of the pathology of disease, showing how they affect the body and how they manifest in various physical forms. Now the diagnosis and prognosis. Detailed diagnostic technique and the prognosis of each disease are discussed with help the practitioner in assessing the disease progress and planning treatment. Clinical application. This section provides a foundation for identifying disease based on their cause, symptom and pathology, guiding treatment decision for various conditions. Chikitsasthana. Position and meaning. The term Chikitsa means the treatment or cure of disease. This section focuses on the practical aspect of therapeutic, elaborating on methods or to treat various ailments. Sequential structure based on diagnosis. Acharya Vagbhata, in alignment with his teaching, Rog Madhav Parikshit to Anantaram Aushadham. First examine the disease, then administer the medicine. Places the Chikitsasthana after the Nidana Sthana, ensuring that treatment follows a proper diagnostic framework. The order of disease addressed in the section mirrors that in the Nidana Sthana. Now the disease. The Chikitsasthana comprises 22 chapters. Each outline Ayurvedic treatment protocols for a specific disease. It offers detailed therapeutic guidelines for conditions such as kasa, cough, swas, asthma, hiccups, rajyaksham, tuberculosis, chardi, vomiting, hridrog, heart disease, trishna, morbid thirst, madhyatya, alcoholism, atisar, diarrhea, grahani, sprue, mutraghat, urinary retention, prameh, diabetes, gulma, abdominal messes and udar, ascites, etc. Now the Kalpasthana. Kalpasthana deals with the preparation methods, doses, complication and management related to Panchakarma therapies such as Vaman, therapeutic emesis, Virechan, purgation, Basti, medicated enema and Nasya, nasal therapy. It also includes guideline on the proper collection of medical substance, Aushadhi Sangrah Vidhi, preparation of the herbal decoction, processing of medicated oil and ghee, Sneh Paka, and the measurement of drug doses, Mana. Uttarasthana. Uttarasthana comprises 40 chapters. This extensive section addresses the remaining 7 branches of Ayurveda apart from Kaya Chikitsa, internal medicine. It covers areas such as Shalya Tantra, surgery, Shalakya Tantra, ENT and ophthalmology, Kaumarya Bhritya, pediatrics, Agada Tantra, toxicology, Rasayan, rejuvenation therapy, Vajikaran, aphrodisiac therapy and other specialized treatments. Now, new insight in disease classification and prognosis by Vagbhata. Vagbhata identified the Visheshan of blood Rakta as the primary cause of Raktapit, a hemorrhagic disorder, and mentioned the liver Yakrit and spleen Pliha as the key point of this disease. These organs are now also known to play a major role in blood formation during embryonic development, showing how his insights align with modern physiological understanding. He was the first to establish that Kamala jaundice can occur independently without being a symptom of Pandu anemia. This distinction was not mentioned in earlier Ayurvedic texts, highlighting Vagbhata's advanced clinical observation. Urinary disorders were systematically categorized by Vagbhata into two main groups, that is Mutra Ati Pravarti Rog and disease caused by the excessive urination, which includes Prameha diabetes, and Mutra Apravrati Rog, disease caused by reduced or obstruct urination, under which condition like Asmari urinary stone and Mutra Ghata urinary retention were described. He introduced several new disease entities not described in earlier classical texts, including Haridra, Ratrika, Puruvartrika, Jwar and Urdhvaguda. His contribution added a new dimension to the nosology of Ayurveda. Vagbhata updated and expanded the count of various diseases, providing a refined classification. For example, he listed 36 types of Shodra Rog, minor disease, Netra Rog, eye disease, Karna Rog, ear disease, nasal disease, 75 Mukh Rog, oral disease, and 8 types of Bhagandar, fistula in ano, including 3 types not previously described. On the topic of prognosis, Aristha Vidyan, Vagbhata streamlined the earlier more elaborate discussion found in Charak Samhita and Susrut Samhita, while Charak included separate Indriya Sansthan and Susrut detailed the topic in 6 chapters of Sutrasthana. Vagbhata condensed it into 2 chapters in the Sharira Sthana and Ashtanga Hriday. Despite the brevity, he introduced new ideas such as the view that male patients are generally easier to cure due to strong constitutions, as observation not found in earlier literature. He also acknowledged the role of astrology in disease prognosis, suggesting that if the Graha planet are favorable, a disease are more likely to be curable. This reflects an integration of medical and cosmological thinking in classical Ayurveda. Now, contribution of Vagbhata in the medical science. Vagbhata presents all 8 traditional branches of Ayurveda, including internal medicine, Kai Chikitsa, surgery, Salya, ear, nose, throat, Salakya, toxicology, pediatrics, psychiatry, rejuvenation, and aphrodisiac therapy. Vagbhata Ashtanga Hriday takes balanced theoretical foundations with practical approaches to diagnosis and treatment, making it highly useful for physicians. Vagbhata simplified the concept of dhatu function by assigning a single main function to each, making it easier to understand. For example, Prin nourishment, Jivan vitality, Lep coating, Sneh lubrication, Dharan support, Purna filling, and Garbhotapad reproduction are the key function linked to the respective dhatus. These dhatus support bodily structure and also serve as a source of nourishment and for one another, ensuring internal balance and continuity. Vagbhat determined that food digestion takes about 12 hours, 4 yams, whereas medicine are proceed in 6 hours, 2 yam. This knowledge helped in planning meal and medication timing for better result. Vagbhat advice on food intake includes filling half of the stomach with solid food as stated in the Ashtanga Sangra. According to this, the stomach is divided into 4 parts, one for solid, one for liquid, one for air and one to facilitate digestion, ensuring balance and proper digestion. And this kind of division in stomach is also considered in modern science. The Ashtanga Hriday represent much of the information found in the earlier Ashtanga Sangra, but in a more systematized form, deliberately avoiding lengthy descriptions of religious site and procedure, the methods of treatment and the presentation of medicinal formulation are concise and practical, making them easily accessible to the practicing physician. Now, on the basis of this all detail, we can say Vagbhat, one of the most significant figure in the history of Ayurvedic medicine, made vital contribution to both the theoretical and practical aspect of Ayurveda. His work, especially in texts like the Ashtanga Hriday and Ashtanga Sangra, integrates a comprehensive understanding of the body, mind and spirit and emphasizes holistic health. Vagbhat's synthesis of earlier Ayurvedic knowledge with his unique insight helped to standardize practice that are still followed in traditional medicine today. His approach highlighted the importance of balance, the impact of diet and lifestyle and the profound connection between physical health and spiritual well-being. Overall, Vagbhat's legacy lies in his contribution to the systematization and continuity of Ayurvedic medicine, which remains a vital tradition in healing practices worldwide. So, we can understand the whole health, the whole concept of health is basically based on the healthy mind concept, healthy relationship between the mind, body and the nature, which is described in Charak Samhita, which is described in Sushruta Samhita and which is also described in Ashtanga Hriday and Ashtanga Sangra. Explore your knowledge on this particular topic, you can consult these references which is in the screen right now. Thank you for your patient listening. Namaskar.